And welcome back. Well, we've discussed vein disease here on the show. It affects more women than men, and you've heard of varicose and spider vein issues. But what about conditions like chronic swelling, like lymphedema? There's another condition that we want to talk about called lipedema. I hope I'm saying it right. I'm going to find out from the expert. It's Dr. Deborah Mangione. She is back from the Wisconsin Vein Center and Medi Spa with more. Good to see you, doctor.
Thanks, Tiffany. Good to see you too. Yes, this is a day that I'm really going to be talking more about medical issues than any kind of cosmetic issues, because it is Women's History Month, and I thought we should be talking about things that really affect women much more often than men, and the conditions that only affect women that maybe haven't been recognized by physicians or by even the patients themselves.
Well, I like that. And I think it's important as we look at Women's Month. And it's important that I know there's some insurance nuggets we're going to give that are positive here. So let's first start with lymphedema and exactly what that is.
Right. So lymphedema is chronic swelling. When people have lymphedema, there are some things that can happen from birth, but usually it is a condition that can come on later in life. And usually one limb is more affected than the other limb. The feet are swollen with it. There are certain signs we look for when we're diagnosing it. But the foot swelling, in addition to leg swelling, for instance, when it's affecting a lower extremity, is one prime sign of lymphedema.
Okay, this is actually shot. I think people are going to see these photos and they're going to say, whoa, this is crazy. I have had a foot swell up similar to this on vacation. Can it happen on and off? Because there's 25% of women have this.
Well, 25% of women have venous disease.
Okay.
But as far as lymphedema, about 20 million people in the country are affected by lymphedema for a number of different reasons. Now, this is just a device that can be used at home to help get rid of some of that swelling. And that is something that's really wonderful to know about now, because in the past, there really wasn't anything. Occasional swelling is not uncommon. You know, it can be after an injury, it can be because of hot, humid weather.
Yes.
But when it becomes more of a chronic problem, that's when we're really concerned about it being lymphedema.
Okay, so if someone says, oh gosh, my feet, my legs, my ankles, whatever it is, they do this. If they let it go, what's the concern?
The concern is that the skin gets thickened. It's not draining properly because the lymphatic vessels are really the major drains. Now, this is something different. That's lipedema. So, I'm going to get into that a little later and how we can tell the difference. But basically, lymphedema, when it occurs, can lead to thickening of the skin, and that can be in association with chronic venous disease as well. And when you have this thickened skin and chronic swelling, you're going to have a much higher tendency for infections, cellulitis, for wounds that don't heal, and ulcerations. And actually, the skin can weep with this lymphatic fluid coming out. And it can be really a horrible kind of condition to try to deal with. In this condition, with one leg being more affected, that can be from cancer. It can be from cancer treatments or surgery, radiation, or it can be something that happens as a hereditary problem. And again, these things can be treated very well with the proper either lymphatic massage when you go to a specialist who's a therapist that can do that kind of thing, some at-home devices, and some good compression. So all of those things are important to know that there are actually treatments available. Now, this device is a home use device. It's a pneumatic compression device that gives very gentle waves of pressure to help move the lymphatic fluid up and out of the legs. And there are ones for the arms, there are ones for other areas of the body. And it only has to be worn for about an hour, 3 to 5 times a week. And it really does a fantastic job of getting rid of that excess fluid in the tissues.
The tubes that we're seeing there, is fluid coming out and going into those tubes?
No, not at all. The fluid is just getting mobilized back into your venous system so that you can pee it out, basically. Okay, but it's pneumatic. It's air pressure that's in very gentle flow and very gentle pressures to help move the fluid out of the area that's most affected.
Okay.
So what we see, so in lymphedema, frequently, as I said, goes along with surgeries, cancer, venous disease, obesity. But there is a condition that's really unusual that people have not heard about before, and that is lipedema or lipedema. And lipedema is abnormal fat distribution, mainly in the lower part of the body. And you can see the difference here. The ankle and the feet are not involved. But what's happened is the tissue is almost coming down over the feet because there's so much excess fat.
This
So
is
you can see
progressive, right, Deb?
this is absolutely progressive. There's hypersensitivity of the skin. You can see the stages here. Frequently, it starts in the buttocks or the upper thighs. It usually happens kind of after hormonal changes in women, and this really affects women alone for almost in all cases. And we can see that it can affect different areas of the body, sparing that upper core. So, you can see somebody who looks very slender, and then you look at their legs and they are so much larger than the rest of the body. The patients cannot lose weight that affects the lower body when they have this condition. They may try to really diet, and sometimes a physician or a primary care person can miss that because they just think the person's overweight. But it's not an area where you can just lose weight because you're trying to lose weight. It's not going to go away.
And
so that
we're out of time, Doctor, but I just want you to address the insurance because we got like 2 seconds here.
Okay, so the insurance now does cover treatments for lymphedema and lipedema in almost all instances, as long as the diagnosis is made properly and the proper steps are there for conservative therapy first. They can get treatment with those at-home devices. There are supplements that also should be known about. It's vein formula and lymph formula that's here. And I don't know which way, here we go. Those are just natural supplements made from orange rind and citrus fruits. And so these things are all helpful for these conditions and just important to know.
Well, here's the deal. You guys are also a medical facility. You're extremely educated in all of these conditions. You've got the available treatments, so people got to visit you. Thank you so much, Doctor.
You're welcome, Tiffany. Thank you.
Absolutely.
Sorry for all the information.
You bet. You can visit Dr. Mangione and her team in Pewaukee. They also have a great March special. If you want something cosmetic, you can upgrade your facial that you book with Hannah in the month of March, and she's going to give you a free dermaplane with that facial. I talk about dermaplanes all the time. They're awesome. You're going to love it. The phone number is 262-746-9088. And obviously, if you've got some venous disease, go visit them. They are medical experts too.